So you've been advised to have spine surgery and you're going ahead with it. So this video contains general advice on all your aspects of your health to get ready. Don't forget to click the subscribe button so you don't miss out on the rest of the series. Once you've made the decision to have surgery, there are many things you can do beforehand to make the recovery easier, safer, and faster. Research has demonstrated that the more mobile and fit you are before surgery, the easier and faster your recovery will be. Following NHS guidance on exercise, we suggest you aim to be physically active every day. Any activity is better than none, and more is better still. So this involves performing any physiotherapy exercises you've been given, alongside strengthening activities that work all the major muscles, such as your legs, hips, back, and arms, on at least 2 days a week. It's also advised to perform cardiovascular activity at least 3 times a week, such as walking, cycling, aiming for about 150 minutes of moderate intensity activity over the week. Finally, try to reduce time spent sitting or lying down and break up long periods of not moving. It's important to keep pain levels under control to help you remain as active as possible. Take your regular pain relief as prescribed, alongside other pain relieving modalities such as a hot water bottle or ice pack wrapped in a towel and placed over a painful area for comfort. Obese patients undergoing spinal surgery have a higher risk of developing complications and a poorer surgical outcome. So in these cases, we highly recommend engaging in weight loss services as soon as you can. Regardless of your weight, it's important to eat a healthy, balanced diet, exercise portion control, and drink plenty of water, at least 6 to 8 glasses a day. Reduce the risk of falling after surgery by removing trip hazards and wearing sensible slippers or shoes with non-skid soles, both in hospital and when you go home. There will be a period of relative rest when you go home for the first couple of weeks, so do consider what seating you have. Ideally, you want a supportive and comfortable chair to rest in, as opposed to those kind of low-set sofas. And smoking has been shown to slow down tissue and bony healing and delay recovery after an operation. And it's also been shown to increase the risks of infection. So we highly recommend trying to stop smoking as soon as possible, as well as the use of nicotine products as well, especially in the 2 weeks running up to your operation and the 6 weeks after. It's worth seeking out your local stop smoking services for further advice, and ask your GP or local pharmacist for further information, or visit the NHS Stop Smoking web pages. Employ good sleep hygiene by following a regular bedtime routine that works for you. Sleep at regular times and make sure you wind down and relax before bed, making your bedroom sleep friendly. And for more advice, look at the NHS How to Get to Sleep webpage. Spinal surgery is a major operation, and so you'll likely require some help with certain tasks and activities initially when you go home. Do consider that you'll not be able to drive for at least 2 weeks, and sometimes longer. Make arrangements to have someone stay with you for the first 24 hours, and ask a friend or family member if they'll be able to buy groceries, run errands for you, and maybe assist you getting to your doctor appointments. If you work, you'll need to consider a period of time off after your operation, and how much will depend on what you do and the physical demands of your job, how you get there, and as well as the hours that you work. So make sure you discuss this with your employer, but also with your surgical team. Let your medical team know if you need any additional support before coming into hospital, so we can then help you arrange this in advance. Not only do physical factors play a key role in recovery, but we now know that psychological factors such as stress, anxiety, anger, and low mood, as well as social factors such as poor sleep, lack of support, and job concerns, are very important and directly impact on the level of pain you experience, as well as how well you respond both before and after your operation. And this is particularly true when you've had your pain for a long time. So try to manage your stress and anxiety levels and low mood as best you can by being aware of what triggers it and practicing relaxation strategies daily, such as breathing exercises or mindfulness apps such as Headspace or Calm. Try talking about your feelings to others. You could also contact Samaritans, and the links will be in the description below. Ensure you're fully informed by watching these videos as much as possible to familiarise yourself with what to be doing in the run-up to surgery. It's important to follow these steps. You'll be invited to a pre-assessment clinic in the 12 weeks before your operation, and this appointment aims to ensure that you've got all the appropriate investigations you need, so blood tests, x-rays, potentially ECG or heart readings, to check that you're fit to have your operation. If you have any other underlying medical problems picked up during that pre-assessment, you may be required to undergo further tests to ascertain your fitness for surgery. The British Spine Registry monitors the outcomes of spine procedures, and we collect data to better understand procedures and techniques and the effect on a patient's experience, as well as quality of life. So you may be asked to complete some questionnaires before and after your operation for that purpose. Involvement, however, is completely voluntary. You'll also be invited to an appointment with the surgeons to discuss the planned procedure you're having. We must by law obtain your written consent to any operation and some procedures beforehand. Staff will explain all the risks, benefits, and alternatives before they ask you to sign a consent form to say you're happy to go ahead. If you're unsure about any of the aspect of your treatment proposed, please don't hesitate to speak to a senior member of staff again. Click the like button if this has been helpful and stay around for the next video.